It gives me great pleasure to welcome one of our keynote speakers for today. When I made contact with our next speaker, she sent me an email and said, sorry Stuart, don't have a lot of time to respond to your questions as I'm currently in Geneva representing our government at the World Health Assembly. And I read that several times and went, my goodness, what people do. And here I was gloating at the fact that I was representing my street at our neighbourhood watch meeting just a few weeks ago. I thought I'd cracked it. And so Dr. Rosemary Bryant commenced in the position of Commonwealth Chief Nurse and Midwifery Officer in July 2008. And she was formerly the Executive Director of the Royal College of Nursing for 8 years. She has a broad career in acute hospital and community nursing. She's heavily involved in policy development in nursing, midwifery and the broader health sector. And just some of her things to note, she's a Fellow of the Australian College of Nursing. She's Emeritus Director of Nursing at Royal Adelaide Hospital and is the immediate past President of the International Council of Nurses that has and represents 19 million nurses worldwide. That's a remarkable responsibility to have. And she was awarded the degree of doctor at not one, but by two universities. The Queensland University of Technology and by Flinders University in 2012. So to open our conference with a presentation on thriving through change, let's get out our Swiss cowbells and bang them loudly as we welcome home from Geneva and to our conference, Dr. Rosemary Bryant.
I think I've heard some cowbells. Yes, I got back on Monday morning, so I'm now firing. I was a bit jet-lagged earlier in the week, but I've now recovered from that, thank goodness. Well, I think I have. Certainly by this morning I have. So thanks, Stuart, for that welcome, and thank you, everyone. But I'd like to begin by acknowledging the traditional owners of the land. As you know, it's the Gadigal people of the Eora Nation, and pay my respects to their elders past and present, and their elders from other communities who may also be here today. So thank you to APNA for inviting me to your national conference again. I did have a very interesting time with when you had Tony Jones in a Q&A. Was that last year or the year before? Last year. See, was the year before? Oh, I can't remember. Anyway, but it's a real pleasure to be here once again and to catch up with so many old friends. So I was invited to provide my opening remarks today on how primary healthcare nursing is thriving through change. In other words, the theme. So to do so, I think it is apt that I touch upon the 5 streams interwoven into the conference program. And these are leadership skills for primary healthcare nurses, absolutely vital. We do it differently, some challenges and different care settings. Enabling change, essential skills to transform your practice. Conversations to enhance patient outcomes. And influencing policy to transform primary healthcare. So my talk today is brief. I could go on all day on all of these subjects, but I've only got a few minutes, so we will proceed. So the first is of course, as I mentioned, leadership, which is integrally linked with retention and productivity of the workforce and has a direct correlation to excellence in patient care and patient experience. The UK's report of the Mid-Staffordshire National Health Service Foundation Trust Public Inquiry, as well as the final report of the Special Commission of Inquiry into Acute Care Services in New South Wales, which is the Garling report, both emphasised the importance of leadership in building a positive culture and workplace environment and recommended that nursing and midwifery leadership training be implemented at all levels of the professions. So it is of great priority that we invest in the future of nursing and midwifery by focusing on the importance of leadership as an essential component of contemporary management. And I was struck when I read the Gowring report, it's a few years ago now, at how so many of the observations and recommendations were about nursing, the need and the essential nature of nursing leadership. So I'd like to move now to the second stream, which is we do it differently, same challenges, different care settings. So I'm going to flip this statement on its side a little by making it different challenges, different care settings. While there are certainly uniform challenges across different care settings, such as our ageing population and the rise in chronic disease, there is also a subset of unique challenges which are specific to nurses working within the primary healthcare nursing setting. Recent research by Flinders University has indicated that some newly appointed practice nurses were unable to consolidate partnerships with other service providers until they felt confident in the system in which they are working. Now that would come as no surprise to you. Another challenge expressed in this research is the reported feelings of isolation experienced by practice nurses as they adjusted to a smaller clinical setting without a team of nurses around them. And this was for those of you who've been around since 2001 with the first initiatives into general practice nursing at that time, as it was called. I think that was one of the big issues that was brought to our attention for nurses, particularly as we rolled out some of the government initiatives at that time. However, in this research, this is going back to Flinders, there was one challenge that really captured my attention. One nurse was quoted as saying, "No precedent in my practice as the first nurse ever. No job description, no policy, no procedures." In my opinion, there are both common and unique challenges to the practice nurse in the primary healthcare setting, and I'm confident that this conference will explore some of these challenges much further than time permits me to do so now. But of course, as we all know, nurses are very resilient and innovative, and I'm sure this nurse, who I've just quoted, just got on with it. I'd like to turn now to the third stream, essential skills to transform your practice. Again, the Flinders research has indicated that for nurses new to primary healthcare nursing, a much broader skill set is required than in the hospital setting. One practice nurse, when referring to the breadth of clinical skills required, was quoted as saying, "I had worked with mums and babies for years and years, and so I hadn't worked with male patients or the elderly. This was like going back and learning a whole new set of skills." It's my strong sentiment that ongoing education is absolutely vital for all professions, but particularly in nursing and midwifery and other health fields. We all know that healthcare is rapidly changing. Ongoing education or continuing education or CPD, whatever you want to call it, is vital not only because healthcare is changing, but also because nursing and midwifery is changing as well. And we are standing at an historic point, in my view, in the development of our professions, both internationally and here in Australia. I'll turn now to the fourth stream, conversations to enhance patient outcomes. Under the second stream, I briefly mentioned the challenge facing the whole healthcare sector with the rising incidence of chronic disease, and all of you will have had extensive experience with this. It's crucial for nurses and midwives within the primary healthcare setting to not only manage the complexity of non-communicable disease, but to also include lifestyle-based questions in their assessments and provide advice about health promotion and disease prevention. A very recent journal article by Anne Parkinson and Rhian Parker states that the contribution of registered nurses is an essential component of interprofessional teams in the management of people with complex chronic diseases in primary care. The authors continue by acknowledging that the enhanced use of nursing resources can improve patient contact, education and disease management. End of quote. In this vein, please don't underestimate the importance of your conversations with your patients or clients. The final stream of your conference is policy problem solving and innovation. And of course, in my opinion, this is quite closely tied to the stream of leadership. The provision of healthcare in most parts of the developed world is undergoing quite rapid change. And it's for this reason that we need strong nursing and midwifery leaders to make their voice heard at the policy level and to be the guiding force of reform. For health reform to occur effectively, nurses and midwives need to be part of the reform process. Those who are in key leadership and management positions need to be adequately prepared to help shape policy. No good being in a position if you don't really know what the agenda is. It's also important that they work effectively in interdisciplinary teams, plan and manage effective and cost-efficient services, and involve communities and key stakeholders in healthcare planning and delivery. So it's really important that we help prepare other nurse and midwife managers and leaders for this task. Experience suggests that health reform is developing at a rate that many nurses and midwives have been unaware of or are unprepared for. And I think you probably have all experienced this. I certainly have. And to this end, it's absolutely necessary that nurses and midwives have a solid understanding of the context and purpose of health reform, a vision of how healthcare services may develop, and the ability to plan strategically for and manage change, and the strength and confidence to be proactive in a challenging and often stressful change environment. And this conference, I'm sure, will assist in preparing you for this. So with time no longer on my side, I'd like to conclude this short presentation today by acknowledging that due to the essential nature of the work we do, the size of our professions, that's midwifery and nursing, and the support we have in the community, which continues over a 20-year period of actually gauging that support, nurses and midwives can and should be a very powerful and important voice of policy development and innovative change. So thank you very much, and I hope that you enjoy the conference, but I also hope that you achieve your goals at this conference that you have chosen for yourselves. Thank you.